Anthea, you are also a keen paddleboarder, aren't you?
Yeah, good for the core.
She's a living advert for it. You will love our next film because scientists have proven that being near water boosts your well-being, both mentally and physically. Just look at that.
Former Olympic snowboarder and presenter Amy Fuller finds out why so-called BlueHealth is so good for us and how some people have been getting it on prescription.
Life can get pretty busy, so when I need to clear my head, I often find spending time near water can have a pretty calming effect.
If you want to boost your mood, getting out into the great outdoors is usually a pretty good shout. But there's growing evidence that there's something very specific about the effect water can have on our mental health.
It's called BlueHealth, the idea that being in or near water is good for our physical and mental health. And some experts even believe blue spaces, such as rivers and lakes, could be even more beneficial than green ones.
It's an idea that's making such big waves in research and medical circles that it's now even being prescribed on the NHS.
A report by the Mental Health Foundation in 2021 found that 65% of the people they surveyed said that even just spending time near water had a positive impact on their mental health. Dr. Elliott Lewis is an environmental psychologist from the University of Exeter.
There are a raft of benefits to be had from a reduction of diseases such as cancers and diabetes, for example, right through to mental health benefits such as relief from anxiety and depression. And it's really those mental health benefits where the research is most consistent.
What is it specifically about water that is so beneficial?
Some people talk about the kind of repetitive rhythms of waves and things like this, the rippling of waters and the kind of patterns that you can perceive. And these are all really attractive ideas instinctively. It's instinctively something we all feel. But the evidence for those kinds of mechanisms is much less strong than the evidence for these environments being supportive for things like social contact and for things like physical activity. That's really where the weight of evidence lies.
Is there a recommended amount of time that you would suggest?
We recommend around 120 minutes per week of time spent in nature for the improvement of health and well-being outcomes.
That might sound like a lot, but it's less than 20 minutes every day for a quick walk in some green space. And if you can, buy some water.
I knew there was something deep and meaningful about water for me. So it was interesting and reassuring today to meet so many people that felt the same way. 60% of our bodies is made up of water. It's the foundation of who we are. So it's no wonder why we find the benefits of BlueHealth so impactful on our well-being.